special panel on humanitarianism and COVID-19, reflection from humanitarian organizations. In this panel today, we will learn from experiences of Muslim humanitarian actors dealing with the pandemic in Indonesia and in Pakistan. We have asked 4 distinct organizations to share their experience from delivering aid in the time of the pandemic. How has the pandemic altered their ways of working and their priorities? What have they been able to do? What have they not been able to do? In what ways has the pandemic affected resources, partnerships, and activities? In what ways have the gender and the minority needs been addressed? We will, through this next 2 hours, hear about obstacles, but also about opportunities that have arisen in the wake of the pandemic. And we will attempt to extract some key lessons learned from the pandemic. I think it's important to say that now working with faith-based humanitarian organization, we also look forward to hearing reflection on how religion has played into the response. What has been the role of religious leaders and authorities? What's been the role of Muslim humanitarian organizations? In what ways have religious text and authority been used in the pandemic, in which, what if any, has been the role or challenges of Muslim humanitarian organization in upholding religious practice and rituals in pandemic times? We have 4 extremely experienced organizations with us here, and we have from Indonesia, Indah Priyanahanda from the Harfa Foundation and Arif Harun from the Zakat Forum Association. From Pakistan, Shahid Iqbal from the Khidmat Foundation and Syed Ahmad Ali Shah from the Minja Welfare Foundation. Moreover, we have a very experienced discussant with us, Dr. Jonathan Benthall, Honorary Research Fellow in the Department of Anthropology, University College London. Most welcome to all of you. What we will do now is to have 4 presentations from these 4 organizations where they tell a bit about themselves and then go into how they've been responding to and handle the pandemics. We will then invite Dr. Benthall for a comment, and hopefully then there will be time for some discussions among our 4 organizations and the discussant, and also open up for questions from the panelists. I will ask everyone then to post a question in the chat. But also, if we overlook something, just please raise your hand and we will try to accommodate discussions here and then for people to share or ask questions to the panelists. So most welcome to all of you. I wonder if we should start with our 2 panelists from Pakistan for this first presentation. Can I invite Shahid Iqbal maybe to be the first on 10 to 15 minutes of presentation, please, if you can share your.
Thank you very much. I'm going to share my screen and hopefully it will work. Yes, if you can see my screen, please. Thank you. So I have to launch it again because the launcher was not working. Maybe.
We could see it a minute ago. If
yes,
you...
but it was not like in the presentation mode. I hope it will work now.
Thank you. May I ask if there is some
Yes,
progress?
no, it's
From him? Oh, there we are.
working now.
Thank you.
So, yes, it can work. Thank you very much for being with me for these few minutes. So thank you everyone, and assalamu alaikum to everyone, and good afternoon from Pakistan. So I hope you are listening to me.
We're all listening very close, but it's not the presentation we see here. It's more an overview of your files, I'm afraid. But it seems that you just need to click on the panel session, and we will all be with you on the presentation.
I think that now it's sharing or not?
There we are. Thanks a lot.
Thank you very much. So I'm Shahid Iqbal, and I'm you can say that working as Secretary General of Al Khidmat Foundation, Pakistan, and I hope that, yes, that's it. So I worked for the last 20 years in development sector, and I have been the executive director of this organization. Now I am reporting and looking for the national and international operations and management of the organization. So my presentation is focused on the pandemic, that is the COVID-19. So I haven't focused on the organization, but a little bit things I will explain it in the way when I will be going on to explain this. It's a panel session that was Humanitarianism and COVID-19, reflections from Humanitarian organization. There was a few guidelines, so I have tried to show that guidelines and arrange my slides so that we can have a harmony in our discussion, and we can have some lesson learned at the end. So the first thing that I have chosen that the COVID-19 how it has changed practices and priorities. So I think that our first priority was in this COVID-19 was to save maximum human life and to secure human life. So that was a priority for most of the organization and communities. Then comes the safety of our staff and volunteers. It was a unique situation. So this was a challenge that oftenly came in disasters. It is a routine matter, but this time because it was an epidemic, so the safety of the staff and volunteers were of utmost importance. The other thing was there was a major shift in working mechanisms, or you can say working model, as there was no socialization. So you have come up with unique ideas and ways and means with people to you say operate in the communities. The next thing was that it was we were embracing the culture of remote working, remote management, and all these things were from the day first. We felt that things are not that simple. I have also been part of the team that managed the earthquake of 2005, the floods of 2010. But this pandemic was different. Most of the people were in their homes. Our board was stuck in their homes. There were lockdowns. So the remote working and remote management was another practice that as well. So another thing is that you have to be flexible with your working environment. The staff couldn't get to their offices and their workplaces and their project sites. So organizations have to be flexible. And that was another practice that is now become a routine in the last 1.5 years. One thing that is common everywhere, and you all people know that there was ICTs everywhere, that information and communication technologies, we were deploying it in our offices. It was being used in the decision making. Like for the first time, our board has a meeting on WhatsApp and Zoom. And so this was like a new phenomena, and it got matured with the time. Online financial transactions were, although it was like taking place in our system, but with this pandemic, you can say that it speed up the process of digital gateways and different payment modes that we can transfer things to our offices and to the beneficiaries through digital means. Meetings and monitorings are all as well on different digital platforms, and service delivery, even like you have to respond to calls, and for example, you have a service delivery was at our district offices or our regional offices. They rely because the banks were quite closed and all these things. So most of the service delivery items was also on the digital platforms, most of them, although there was field work as well. Our service delivery started by Al Khidmat Foundation has a footprint all over the country. So our service delivery started that we formed a Corona task force. It is still intact. The fourth wave is, you people better know, it's has hit Pakistan for the last 1 month. Then there were awareness campaigns through print and electronic media and social media, disinfecting campaigns that we have touched the mosques, churches, temples, hospitals. We created then the COVID care wards in different of Al Khidmat Foundation owned hospitals. We set up 5 virology labs for COVID testing. And then we have a healthline services, that is a you can say a telemedicine services that we initiated with one of our sister concern, Pakistan Islamic Medical Association, that called PIMA. So we jointly operate this project, and this is functional as well. So then there was a shortage of oxygen cylinders in the country, and we are still running this project with the fourth the wave as well. So the food distribution was, you know, that the daily wage workers and labor badly hit by all these lockdowns. So there was a massive food distribution as well. Other organizations in Pakistan and other communities themselves also helped in these distributions. Then we have an active participation in vaccination trials and the 2 Chinese trials that taken place in Pakistan. We were part of their trials, our volunteers and our management. They volunteered themselves for these trials, and it's still going on for the few of the vaccines that are in trial in Pakistan. Then when the vaccination started, there was some fears and some conspiracy theories. So there was need of an awareness campaign. So we have to go into that campaign as well. It is still going on. So these are just a few numbers that 30,000 of our volunteers participated, around 2 million of the face masks and gloves. These were just for people to know that what is a face mask, what is a glove. You know that when this pandemic started, these were new phenomena. So we have to distribute it in different streets and institution and all these. Then there was a shortage of that protective gears. So we have to distribute it in different hospitals and quarantine centers and all these. Then the disinfection sprays, this was one of our major projects. Around you can say that 1,400 hospitals in the country, that was in the public sector or private sector, we disinfected that. And then the COVID PCR lab we established. It was like on a war footing. Our first lab was up and running in I think around 60 days after the pandemic, as soon as the government has allowed to have labs or diagnostic centers for COVID in Pakistan. Then one of the major thing that we have done is the disinfection and sprays in the mosques, temple, churches, and all this, so that people can aware about all these hygiene and these things during this corona. Then we have established some corona wards, so that if there was an overflow of patient from the government institution, we can have that. Food packages was one of our, you can say, a major drive in the first wave because there was massive lockdowns. So we almost reached to 700,000 families in that. Then there was some cooked food in some special cases. So we expanded around 16 million US dollars, and 9.2 million people in Pakistan benefited in our campaign. There was some awareness material in Urdu and English and different languages that we had disseminated through social media and through different means. So these are just then we have in the third wave, we started the webinars so that we can educate people about the vaccination as well as all these trials that were taking place. And we have partnered with one of the largest university in Pakistan, that is the University of Health Sciences, that is a mother organization of medical colleges in the country. So we have an MOU with them, and then we have also participated in the passive immunization drive as well. And for that, we have also signed an MOU with IBD that is authorized by the government for the passive immunization. As I have told you that we have a health line to provide telemedicine services. The people who cannot leave their houses, as most of the hospitals were shut during these days. So it was like a service that we were providing them through all these things. The other point that was highlighted in the topic, that was that the resources and partnerships, like how it has evolved. As we have seen it, that we have a good sustained relationship with our donors. As we were in the field, we were delivering these items, and we were up and running all over the field. So our donors were with us, and we now feel that now we have a very sustained relationship with our some of the new donors and with our old donors as well. During this pandemic, initially we thought that there might be some problem of resources, but gradually after 2 or 3 months, we realized that new streams of resources have emerged. New people have started donating. There was, you can say, we have built partnership with the corporate entities. I a few, the Pepsi, the Mobilink, few of the banks, the airlines. So they're starting approaching the social organization or the NGOs, and we have also partnered with them. So these was like the new resources and new partnerships. So it was, you can say, a positive outcome of all these. The next one is that how you can say the Muslim charities have accommodated the minorities and transgender and other neglected groups or vulnerable groups of the society. So it has a very amazing story that it was the first time, although we have projects for minorities in, you can say, in one of our provinces in Sindh. We have a hospital for the Hindu community in Tarparkar. But it was the first time that in the whole of the country, we targeted these vulnerable groups. We visited their offices, they visited our offices. And for the first time, it was for us that we approached the transgender community as well. And now we have a good, you can say, meaningful interaction with them. They usually visit our offices. And now we are planning on some, you can say, long-term projects for their skill development and livelihood and all these. So it was very good interacting with the minorities and transgender during this relief operations. There were quite a few challenges as well. Like, you know, that the first thing was that you have to convince the people that the pandemic is real, because most of the people there were conspiracy theories, even emerging from the West and East as well. So this was like a major challenge, that whenever we were interacting with the people, no one was following the SOP, the masks, and all these things. So it was a challenging one. This was a new and unprecedented form of restrictions. For example, in the first 2 to 3 weeks, transport was halted and businesses were shut down. So you can say our supply chain was also disturbed. And that was another thing. Jobs were lost, and there was rumors that businesses will decline. So you can say there was a stress in the business community as well, and it then dictates the whole environment as well. The other thing was that there was we have to you can say maintain a very minimum physical activity in our offices, in the field. So it was a new challenge. Like in other, you can say, disasters, we invite all our volunteers and our workers. But for this, we have to be very careful, very specific, so that not a lot of cannot be converged into a single place. In the initially 2 to 3 months, there was difficulty in availability of relief items and equipments. As you know, that China is one of the main producer of all the medical equipments and these things for Pakistan. And when its shipments were halted, then there was also a surge in the prices of all these commodities, but there was a shortage as well. One of the major things that there was a stress among the communities, and it has affected our staff and volunteers as well. So we have to diffuse that as well. It was also, there was uncertainty, some mental health issues among masses. So these were, in my view, these were the challenges that our organization, or I hope that all other organizations have faced that as well. Some of these were like major problems. What the pandemic has offered is that, in my view, it has offered a lot of opportunities. Like you can say that our last year budget was almost 40% increase in our last year budget and spending. So we think that agile and smart organizations, they have survived. Those organizations who have the capability to adapt to the situation, it has become an asset for them. Those organizations that were aggressive in use of modern technology, and it has speed up the process as well. So I think that it was also like an opportunity for organization. For example, in the first 3 to 4 months, we have started a major, you can say, digital transformation in our organization, and we have invested it in it a lot. Then we have gained confidence as well, and we have discussed confidence that in uncertainty and uncertain situations, even organizations like us, we are a community-driven organization, and we are, you can say, a volunteer-based organization. So now we are confident that we can work in fragile situations and in such unprecedented emergencies as well. When the first wave was over, then different organizations started their contingency plans for the next one and the next one. And you know that it's the fourth wave in Pakistan, but there are plans, and many of the things are under control on part of the government as well as on the organization. Then we have realized the power of synergy, like synergy with the businesses, synergy with the fellow organizations, synergy with the government. So it was also one of the lessons learned from this. You can say I have used a lot this unprecedented word for this pandemic, or you can say disaster. So, and there was one of the key things that we have gained is more sustained relationship with our donors and stakeholders. Our donors or our well-wishers, they are now like posing more confidence in our systems and in our work. So, and one of the major thing that we have also worked a lot on the improvement of our health facilities, and the government and other organizations are also working on the same lines. Next line is that role of religious leaders. I think it was very much positive, a few exceptions, but they supported the governments. They issue fatwas or degrees that allow that Jummah prayers can be halted, and about the Hajj and all these things. And the religious community were very connected with, you can say, their people in their localities. So I think that education community was, and they also start sharing these things, that how Prophet Muhammad Sallallahu reacted in situation when it happened once in Arab, and according to Islamic teaching, what is how to react during a pandemic. So it has also helped in ensuring somehow good mental health of the people, that people have faith. Is, you know, that Pakistan is a country used to hear to sermons and used to hear to these religious leaders and community leaders. So it was a good thing. The SOPs enforcement were quite like amazing in mosques and other worship places. And you can say that the masjid committees, that the local committees that used to take care of the masajid, so they have played a role in, we have worked with them in identifying vulnerable people and providing that assistance with the minimum physical interaction. So and ensuring the communal harmony as well. Role of the Pakistani government was, it was also commendable. They have established the National Command Center for combating the COVID, and it was, you can say, a single window operation for all these COVID related activities. They have frequent meetings, they issue SOPs, and then they ensure these SOPs. They looked after all these lockdowns and smart lockdowns, and they were playing with the data, so where to enforce these lockdowns as well. And there were regular flow of information. The vaccination drive is going better. And one of the major, that social safety net, the SAS program, they have provided around, like it's their official figures, they provided 14.83 million households with 1,157 million US dollar in cash. And they have, you can say, dispersed speedily through ATM machines and through ATM cards and all these things. And new data was also put according to the, in the emerging COVID situation. So it has emerged as a vibrant social safety net country as well. Muslim organizations as Al Khidmat Foundation Pakistan, there were many other foundations, brother sitting over there is a Hoover, and all the major organizations, they have participated, and we have collaborated in different projects as well. So I think that the Muslim humanitarian organizations have played, they conducted an effective and aggressive awareness campaigns, and it has helped the government as well, and it has helped the communities to understand the situation. They remain connected with the people and on the field. So like it has given a much needed like moral support with the material support as well. Wider dissemination of preventive measures and guidelines, and there were organized food distribution to avoid these gatherings, large gatherings. So it was good. And I think that from this pandemic, Muslim humanitarian organizations have learned, like we have learned, that our activities should more be on data driven, and it should be planned intelligently, and we must have good plans for that, use of the new tools and techniques. I've already talked on that. And smart working environment is one of the need, I think, that emerged in the post epidemic era. Thank you very much, and I'm now open for discussion or any question.
Thank you very much, Shahid Iqbal. I think we just move on with the other presentation so we can gather a better overview of all the efforts that has been taking place in both Pakistan and Indonesia. Maybe if you could take away the presentations, because we are back to your overview of files.
Thank you.
Thanks, but that was a very comprehensive and interesting presentation. Can I ask Syed Ahmad Ali Shah to present from the Minha Welfare Foundation, please?
Thank you very much. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum and hello to everyone. Thank you for giving this opportunity to Minhaj Welfare Foundation, and thanks to all of you for your time, for your consideration. I think my screen is shared with all of you.
Yeah, we see it. Thank you.
Okay, thank you very much. Minhaj Welfare Foundation is a worldwide humanitarian organization, and our aim and objective is based on three major areas of concern. One is education, the other is health, and the third one is social welfare. Today we are sitting here to discuss the experiences and the opportunities and what we learned from this pandemic situation. So if we go in past in history, when this was reported in December 2019, and after that, round about in January and up to March, that was spread in all over the world, around the globe. This pandemic was spread, and there was in some countries there was a total disaster. We were hearing and seeing about some Western countries specifically. So at that time, just because of these media news, people were realizing this, and here specifically in third world countries, as the education level is not that much and socialization of people is not that much, so people were not believing in that, as Brother Shahid also discussed the situation. So here in Pakistan, when total lockdown was announced in, I think that was around about mid of March when total lockdown was announced in Pakistan. And for social welfare organization, that situation was very challenging. And people were asking about that to help those people, specifically those daily wages who were not having now their source of earning, and they were sitting at home just because of that lockdown. And that was the need of that situation at that time. So the role of social welfare organization was become more specific. So the first thing was that to make an awareness, for that awareness campaign, our founder and leader, Sheikhul Islam, Dr. Tariq Qadri, addressed the people a number of times, and he discussed all these pandemics situation in the light of Islamic education. So this was I think a great guidance by Sheikhul Islam, that all the followers, millions of followers are there around the globe. So when he quoted Islamic references, how to protect themselves and how to protect societies from any pandemic situation, and he declared this, that this is a pandemic and don't take it easy. This is a serious situation, and you have to keep social distance and keep away from each other and follow all the SOPs, wearing masks, gloves, and use of sanitizers and washing hands. So that was, I think, great support by that leader to his follower as well as to the society and masses. Specifically, when people were thinking about that, this is actually a conspiracy, not more than this. So when such a leader came in the field and he announces that this is a real pandemic and you have to protect yourselves and your families, your societies in this way. So for creating awareness, that was a great contribution by Minhajul Quran as a whole and by Minhajul Foundation in specific. Then we supported the same awareness program, and through that awareness program in masses as well as specifically in our members and workers and volunteers, we created this atmosphere that first of all, you have to protect yourself and to follow the SOPs announced by WHO as well as by the government of Pakistan. So through this way, you may support your society as well as your families and yourselves as well. So after that, then if we come towards the tangible humanitarian activities, then that was a very challenging phase, specifically in my experience, because we haven't in past we were not having that type of experiences. So this was a totally a new experience for all of us. And specifically for the humanitarian-based organization, that was very challenging time. The reason is due to lockdown, availability of all those things which you are going to provide to people, specifically the in huge and bulk amount of food items, ration, and then the packing material. And the most challenging was how to transport and how to distribute. The logistic issues was very challenging at that time. And to keep social distance, you have to do all this by keeping social distance. So first we decided that to have our relief activities through door-to-door campaign. And we did this in a very effective way. And in this slide, you may see a picture that is showing that we are doing that door-to-door. But specifically, to keep social distance, that was the actual challenge for us, and to keep our volunteers as well as our workers and members and staff members protected from this pandemic and from that infection. So that was the real challenge. Availability of our food items in bulk, so purchases of that, and then to transport that in different areas, time constraints, all those were challenges. So from that door-to-door campaign, we realized that we would be not that much effective. The reason is that masses are there, and thousands of families were waiting for us for their food because people were hungry, people were not having their source of earning. So the segment which we were targeting. So in door-to-door, keeping in view all those challenges, so that was time consuming. Then we decided to shift our activities in some other ways. And then by keeping social distance, we arrange some other activities in bulk, in large number. But that was another challenge, because controlling masses and to keep social distance, that was another challenge. So for that purpose, then we contacted government officials, and Pakistani police and security forces were very supportive in that situation. And then to avoid any mismanagement, then we made lists of all beneficiaries, and a coupon was issued to all the beneficiary families, and they were coming in a specific time, and they were collecting whatever their package was, for food package, for their hand sanitizer and all other relief goods. We distributed cash donation as well. The reason was that in some remote areas, if that was not possible to go there and to manage all those activities in an effective way and to keep social distance, so in that way we distributed some cash donations as well. But to overcome with all those challenges, our strategy, there was a strategic change on continuous basis, that where and when and with which strategy we may be more effective. So that activity was very effective. Here in this picture, you may see that when we were doing our campaign, so then we shifted our activities like this, that to keep the social distance as well as to distribute it in an effective way. So through this way, you may see that everyone who is coming in that pandal, who is coming in that premises, that person was supposed to have to wear gloves as well as to wear mask and to keep social distance. For keeping social distance, these packages were placed in a specific from 5 to 6 feet distance. So this was very effective, because through this way we distributed hundreds of food packages per day, and time constraints was controlled in this way. Alhamdulillah, the activities of door-to-door, where that was possible, the activities of keeping social distance was conducted, and through this way we achieved our target, and we achieved our targeted number, that in Pakistan, through our network of volunteers, we distributed 160 million food items all over the country. So that was a big number. And before this, in 1 year time, and in very few months, in that very specific period of time, that was not possible. So I think that was an opportunity, and why the people, I mean the donors, responded in that way, in that rapid way. The reason was that all the religious scholars played a very vital role in motivating people to spend in the way of God, in the way of Allah. The reason was that people were in need of, and most of the people, as you would be aware of, that around about 50% of population are living here in Pakistan below poverty line. So in that, specifically for the daily wagers and the people whom jobs were affected by lockdowns, so they were not having any source of income, and their kids, their families were crying for food. So that was the main challenging time to support them. And then through religious scholars and religious ulamas, they played a vital role in motivating people that this is the time to spend, and this is the time to have your charity for your brother and sisters. And through this way, people spend more than normal conditions. So this was a great opportunity. And specifically the next opportunity, what we learned, and what was the opportunity from this pandemic, that is that digitalization. Today we are sitting in our own offices and contacting each other. So before this facility was available, but we were not using all these facilities like this, what we are doing today. And for our fundraising as well in social welfare sector, we focused on digital fundraising as well, in promoting our products specifically. So this was the basic opportunity that through this way, our fundraising activities are more, and our funds are more than ever before, as before this pandemic situation. Then the next thing was that to have all these activities in an effective way, we should be more organized in future, specifically to handle such situation in more effective way. So for that purpose, now our volunteers are more aware, they are more trained, and they have the consideration how to keep social distance and how to support the people in such situation when your resources would be limited, when you will be having time constraints, and in all these challenges, you will be going to support your needy brother and sister in more effective way. So this is these are more opportunities which we have. These are some snaps of our activities all over the country. These are the Kashmir activities. One is on left side, the Kashmir activities, and on right side, that the northern belt of Khyber Pakhtunkhwa. We distributed a relief package there, in which we distributed blankets, sweaters, gloves, socks, and food items as well. So Here for solidarity and humanity, I believe that, and Minhaj Foundation believe the well-being of humanity is the responsibility of every individual. We have to take our role in consideration. If we consider this, that we have to support humanity, and let me share that during all this pandemic situation and our relief activities, our whole activities as ever before, that was based on humanitarian basis. Apart from sects, from any religious background, any language background, sects, and everything that was not considered in that. And let me share some information with you that to support and to bring them out of this miserable condition and to have a good feelings for them. Last year we celebrated Christmas in different churches by Minhaj Foundation, and cooked food was distributed there, dinners and lunch were distributed there, and Christmas cake was celebrated and cuts and eaten there. So through this way, that minorities were also kept in consideration, that not to have that feeling that we are minorities, we are from minorities and no one is asking for us. So Alhamdulillah, we did that as well. And in last, I pray for the prosperity and solidarity of all who continue to support this effort, and remind ourselves of the prophetic saying, the righteous is the society, is the one whose action benefit others. This is our belief, and through this belief, we are doing our all welfare activities. Thank you very much.
Thank you very much, Saeed. This was again very encouraging to hear, and how you also managed to bridge across different minorities in Pakistan and reach out to everyone. Would you mind taking down your presentation, because now we've had two extremely well-prepared presentations from Pakistan and learned a lot about there. So time to turn to Indonesia, which I'm also sure there is a lot of activities going on and lessons to be learned. Sure, can you take down the presentation, and then we can invite maybe India Prihanand can be first out. Is that okay with you from the Hartford Foundation?
Okay, I will trying to share the slide. Just a moment.
Good. We need to take down the slide from the Minhaj Welfare Foundation first, I think, if someone can do that. There we are. Thanks a lot.
Okay. Bismillahirrahmanirrahim. I'm Indah Prihanande from Lembaga Mizakat Harapan Duafa, or we can call Harpa Foundation. This is the first time for me to attend the session, and I'm so sorry about my English is not good. I asked already for Prof. Amel to help me to translation in this session. Okay, this is this is our organization, Las Harapan Duafa, a social humanitarian organization which running as a faith-based organization located in Serang, Banten, Indonesia. Experience in managing zakat, infak, sodako, and wakaf. We are focusing on various programs, especially in health and economy sector, which separate into some programs, such as community-led total sanitation, or CLTS, and microfinance group for women. We are targeting the most vulnerable communicates in rural areas. Okay, in Banten Province, Indonesia. Las Harva implemented program mostly contribute to sustainable development goals achievement in some of point. We can see in this slide number 1, 2, 3, 4, 5, 6, 8, 9, 10, 13, and 17. This one is explains about SDGs. I think I will skip. Okay. This is the same thing. Okay. And then this is the main focus program from Las Harva. Number of clean water facilities in Banten province. You can read from our slide after this. We have concern from bulk toilet contraction from methods CLTS, community total sanitation research. Because this is best for heart. Okay. This slide is explained about COVID-19 outbreak and humanitarian response from Las Harva. Is the increasing number of cases of COVID-19 with the spread of the virus accelerating. We continue strive to assess beneficiaries, especially to the most vulnerable communities who needs assistance and protection most. Other than that, we also collaborate with relevant stakeholders who can fight COVID-19 together in various sectors. Include we have collaboration with the Fed from Australia and with Caritas Australia for manage response for this COVID. This one is about organization change. We have strategic change. We have to strategic about the change strategic, and then we change about operational, yeah, and we change about technological because in my organization we have now used technology high, and we also have about behavioral. This is priorities during the pandemic. We have to protect, assess, have the people, and have about beneficiary, and also have about my staff and our family too. And we have advocate, include education this program. The challenge reaching and prioritize to the most vulnerable, as COVID-19 deeply affects economic condition of the communities, especially the ones who relies on daily income. We have to set the priority into the most vulnerable beneficiaries. In this case, detailed data collection is very much needed to support to continue of aid distribution. Human resource capacity. The challenge is human resource capacity. The increasing use of technology and digital transformation in most of the lines of work have forced our staff to adapt and increase their capacity to adapt quickly, because we have no time anymore for wait to use high technology. We also need to support this by providing a capacity building shifting habits to full-time work depending on technology system. And then a distribution and empowerment program. The beneficiaries target who don't really understand the dangers of COVID. Now it is transmitted, and how to prevent it requires us to provide continuous advocacy. This also gives an impact on the distribution of aid, which is increasingly time consuming as the health protocols must be implemented and the advocacy process that always carried out in every ongoing program. Target funds and managing the financial, this is also changed. During the pandemic, many donors are not longer donating anymore, especially offline donors who have decreased a lot. It is necessary to implementation several fundraising strategies, including strategies to educate donors who are used to offline to switch to online channels, which actually make it easier from them to donate. Lesson learned, response management. Response management requires adequate risk communication capacity, accountable and multi-sector partnership and coordination to keep communicates safe and protect are needed. This also include how organization provide the capacity building and preparedness regarding to the program response. And then digital transformation. We use of technology is mandatory during a pandemic. Increasing individual capacity in the use of technology and adaptability in work is absolutely necessary. Communication strategy, so the way we serve the information and how to communicate them properly to society is another challenge within the pandemic situation, where the negative fibers information was also dominate. Point of contact, pandemic control relies on community and engagement and trust when we have the local person as a key to advocate the communicates, especially in a rural area. This can help us to implementing the program. From gender equality, this is prior to this pandemic situation. Lasarva has already put gender equality as a matter of concern. Therefore, we focus on several programs that really involve women. And of them is a microfinance group program, which aims to empower and encourage housewives to become empowered women, especially in their financial matter. There are about 873 women who already involved in our microfinance group program. Other than that, there are about 52,066 women beneficiaries from our COVID-19 response and prevention program, and about 16,125 women which also involved in our Kampung Harapan Siaga. We call Kampung Harapan Siaga like a village, from COVID-19 program in the rural area of Banten province. As of 2020 until July 2021, Lasarva already implement various response and prevention programs for COVID-19 with the following coverage. 13 from COVID-19 response program has been intensively carried out due to COVID-19 outbreak. 13 ini apa ya? 13 program, 13 program for COVID-19. And then 106,332 beneficiary has been reached. This one is explain about the number, and this one we pass ya. This one is Kampung Harapan Siaga COVID-19. What we do for Kampung Harapan, formation and training of the COVID-19 task force, provision of hand washing facilities, spraying disinfectant in village public facilities, provision of personal protective equipment, and then provision of thermal detection on medical masks and hand sanitation, communities and disabled health check, because disabled we have to reach disabled too. And then food ban, health promotion, public education, COVID-19 crisis center and health information board, COVID-19 online media advocation, self-isolation motivation, personal hygiene equipment, capacity building training for religious leaders in COVID-19 prevention, training on making masks and disinfectant for the community, distribution of posters to religious leaders. Okay, this is microfinance group. Microfinance group is a program of economic assistance and revolving fund assistance for business development capital, which aim to increase economic activity, to increase people's income, especially women in the household. Oktober 2000 ini udah ini belum pandemik ya. Okay. This is Mrs. Sumiati was relieved to be able to help increase her husband's business capital, especially in this pandemic situation that makes them even harder to fulfill their daily needs. Okay. This is Mrs. Susi, member of Microfinance Group 2. Mrs. Susi is a member Rasalva Microfinance Group, whose husband lost in his job and a student shuttle driver at a private junior high school in Serang City due to the pandemic. Mrs. Susi said, as my husband has not worked for a year since school has been closed due to the pandemic, so there are no more drivers to pick up and drop the student. There is no income, and even though the needs continue to fulfill every day. Okay, and this one is about kurban. Kurban during pandemic. This year has become the second time for us running kurban program in pandemic situation. There are some lessons that we learn from the last kurban. We learn some effective way, whether in practicing the kurban distribution to rural areas of Banten province. We realize that animal slaughter has given us some risk to be anticipated before the implementation. Therefore, the preparedness is fundamentally necessary, and we have prepared our safety standards so that here we already conduct safe kurban. Okay, and this one is sampling, but success story. Mrs. Juni, 50 years old, is a widow who lives in Margamulya village, Cileles, Lebak, Banten. Is one of the residents who received the kurban meat as a contract oil palm work cleaning service. She usually receive a fee of about to 20,000 per day. Mrs. Juni was very happy to receive kurban meat because usually there is no one has ever been kurban in her village. Eating meat, especially beef, can only be tasted once a year. If only her child sent her the beef. Okay. Thank you very much. Sorry for my English. I hope I hope we will explain after that. Thank you.
Thank you very much. And don't think you should worry about your English. This was very easy to follow, and you had a very nice presentation that shows both your results, but also some of the dilemmas that you met through this pandemic. Can we then move on to the Zakat Forum Association and Arif Haryono, please? Are you ready to present?
Yes, thank you, Mr. Chairman. Yeah, I would like to share screen. Okay, first. Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Honorable Chairman, Dr. Arne Strand, Discussant, Professor Jonathan Benthall, honorable panelists and speakers in this very honorable conference and seminar. My name is Arif Rahmadi Haryono. You may call me Arif. I am right now is the Chief Division of Advocacy in Forum Zakat Association. It is an association of Zakat management organization in Indonesia. And then I'm also currently is the GM General Manager for the Strategic Alliance on Advocacy in Dompet Duafa Philanthropy. My presentation in this afternoon is about the role of Islamic Philanthropy Organization Association in response to the endless surge of COVID-19 in Indonesia. My content of presentation consists of 3 parts. The first one is I would like to introduce about what is Forum Zakat, and then my second part of presentation is about the challenges that most of our members that faced during this COVID-19 outbreak in Indonesia, and what are the challenges that occurred in here in Indonesia. And then the last part is about what is the response of the Forum Zakat Association and our member in response to the COVID-19 situation in Indonesia. Forum Zakat is an association of Zakat management organization in Indonesia. We were established in 1997, focusing on 3 parts of function, that is upgrading competencies and accountabilities of its member. Second one function, our function is about advocacy, and then the third part is about collaboration and synergy. As of August 2021, we have more than 175 members of Zakat Management Organization. Both are coming from government base of Basnas, and then also civil society organization, or we call it as LAS, Lembaga Amil Zakat. Our member spread in 21 provinces all over Indonesia out of 34, and we have also 10 Forum Zakat daerah or region or district that in Indonesia also. Okay, coming to the second part of my presentation, I will be quick because I know the time is very limited. The challenge that in the pandemic in Indonesia, in general, the pandemic in Indonesia is have like 4 main problems. The first one is about the economic. Ever since the COVID-19 outbreak in Indonesia, it was firstly formally declared by the president in March 2020. There's an increase of unemployment. There's also an increase in poverty And then the recent phenomena in several several cities, like if I'm not mistaken, the media cover is in Jakarta and Bandung. There's a white flag phenomena. A white flag phenomena is when the person living in that house or that is working in that office waving the white flag in front of their house to show that they're giving up. They cannot no longer survive this pandemic due to they cannot work freely because of the government restrict the social mobilization. But also they cannot afford any longer to provide their family or their workers during this pandemic. So the economic sector is one of the heavily affected by the COVID-19 outbreak. And then the challenges also that about the COVID-19 is about the disorientation. Many experts, especially the epidemiologists, said that from the first outbreak of the pandemic COVID-19, the government has been disoriented on facing the pandemic. During the first phase of the pandemic, the government is not talking about how can we deal or how can we manage the pandemic, but instead they talk about tourism. And then saving economic is much more important rather than saving the people instead. And then Indonesia is also facing about the very, very minimum of testing rate, let alone of tracking and tracing. The public health is also one of the sectors that was hit very hard during the COVID-19 pandemic. The media cover, I think it was like a month ago that the public health sector are collapsing due to the incapacity of medical personnel, lack of personal protective equipment, and also medical facilities to accommodate all of the affected people. During that time, last month, all of the cities, major cities in Java Island, reporting that all of their hospital and especially the ICU, intensive care unit, are abandoned, are over limited with patients due to the COVID-19. And then the second challenge of in the public health sector is that medical personnel face persecution by the family or the relatives that denying their loved ones are having COVID-19. Some news, some reports said that there have some physical how do you say it? Confrontation between the family and the medical personnel, denying that that their loved one is having COVID-19, and they force the medical personnel to not conduct the COVID-19 procedure of funeral. And then the last one is the challenge of Indonesia, is that the role of social media buzzer that creates public confusion and disintegration. Makes COVID-19 in Indonesia harder to face during this time. And then there's a false information that circulated, especially in the social media, lead to many Indonesians downplaying the COVID-19 as just a common cold, until everything was too late. By August 2021, more than 1,808 medical personnel died because of the COVID-19. As you can see, the number very high. This is a range from not only just a doctor, but also nurse, ambulance officer, epidemiology, and etc. All of them are died because of the COVID-19 in Indonesia. After one and a half years, COVID in Indonesia is not decreasing, but it's spiking and exponentially spread through every province and district in Indonesia. So, what are the role of Forum Zakat or the Zakat Forum Association in Indonesia? The role of us during the pandemic is to consolidate the data and to aggregate the initiative. This is very important because we have to manage more than 175 members that located from Aceh province into Papua province. So the main challenge is how to consolidate the data and to aggregate the initiative from each of every our members so that we could discuss this with the stakeholders, especially the government sector. Members of the Forum Zakat, most of our members that after we consolidate the data and then try to aggregate the initiative is we try to consolidate the data. We have it is very important for the government sector and private sectors to understand the condition in the grassroots because we cannot face the pandemic if we do not have the correct data. Forum Zakat could, members of Forum Zakat could facilitate that real and valid data so that the government sector could have a different insight, and then hopefully they could manage to produce a policy that is accordingly with the needs in the grassroots. And then how we could aggregate the initiative. Forum Zakat established some of media platform that functioning as a center of public information. Also, we coordinate the volunteerism between all of our members of Forum Zakat. One of the many programs is to provide daily meals for the self-isolating person, support small and micro sectors as Ms. Nenda already present, and also re-energizing the food sector. And then the last one is the most important thing is our members is to support the public health sector. Like, for example, some of our members establish a mobile hospital because our health facilities, our hospital cannot accommodate the patient any longer. So many of our members try to facilitate, try to establish a mobile hospital. And then we also provide a personal protective equipment that is include surgical masks and then hazmat suit for the medical personnel, and then supporting oxygen needs for Duafa. This is very important because as our health sectors are collapsing, many our brothers and sisters in Indonesia is in need of oxygen. And at that time, many of patients is cannot be helped due to the lack supply of oxygen. And then Forum Zakat also conduct a public campaign to support and counter the discrimination and persecution that the medical personnel are facing. And then the last one is facilitating public vaccination. Forum Zakat facilitates in collaboration with governments of Indonesia, facilitate the public vaccination for the people through establishing various spots and a mobile vaccination in collaboration again with the government of Indonesia. As of August 2021, our member of Forum Zakat has distributed no less than 1.5 million US dollar. This numbers is only coming from 41 member from our organization. So this is just a 1/3 of our full power of Forum Zakat. But Alhamdulillah, we already distribute 1.5 million US dollar distributed into 22 provinces and 70 districts in Indonesia to the needed person. This is some of the pictures that our member trying to help to ease the pandemic effect in Indonesia, providing a mobile hospital or rumah sakit lapangan, and then to provide oxygen need that is needed in the during this situation. Forum Zakat also coordinate with the stakeholders, especially the government. We are having a very intensive communication with the BNPB, or the National Coordinating Disaster Agency in Indonesia. Also, we coordinate intensively with the Social Ministry Affairs, and then with the Ministry of the Coordinating of Pembangunan, Menko PMK. I forgot. I'm sorry, I forgot the English terms of the Menko PMK. And in terms of aggregating the initiative through platform, Forum Zakat together with Warga Bantu Warga, or as in translation is Citizens Help Citizen, we try to provide a database of hospitals and health facilities, so that everyone that is in need of medical support can have some day-to-day and real-time information about which hospital is empty and available for a patient to come and be treated accordingly. This also aggregated initiative is also acting as connecting the dots of stakeholders. As we all know, we have 175 members of Zakat Organization, but through this Warga Bantu Warga platform, we also connected with other civil society organizations that is have the same goals and have the same vision and mission to help those in need as fast as we can. Lastly, I would like to share some insight that through our experience conducting managing the pandemic for 1.5 years, is that collaboration is a must. Although we have 175 members all across Indonesia, still we cannot work alone. We have to collaborate more with other civil society organizations. We have to collaborate more with the government, so that many of our Indonesians that is affected and in needs of help and support, medical support, can be delivered the assistance as fast and accordingly to the needs. Also, my second insight is that managing information during this pandemic outbreak is as important as managing the pandemic itself. The challenge of having a very free social media platform in Indonesia is that the information is carried out very easily, and we cannot filterize which information is correct. So although our organization, our Forum Zakat is try to provide the correct information as much as possible, but we have to collaborate with a lot of stakeholders, so that the information that is provided for the people can be correct. And then lastly, probably solidarity and community initiative probably is one of the main point on Indonesia surviving this pandemic, hopefully, inshallah. Thank you very much for all your kind attention. I would like to hopefully we could have a very fruitful discussion. Thank you very much, Mr. Chairman, Dr. Arne Strand. I will give back to you. Thank you very much.
Thank you very much, Arif. This was an excellent analysis, and then thank you for somehow putting it into the context of Indonesia. And also, I was very impressed by your ability to both collect data, verify it, and then provide it back for the population so they can make informed choices on which hospital to go to and not. So this was very enriching. Jonathan, can I kindly invite you to comment on this very rich presentation from our 4 panelists?
Thank you very much, Arne. Can you hear me? Can everybody hear me? Please say if you can't. I haven't prepared anything. I'm just reacting to the 4 excellent presentations we've heard, but I'd just like to go back a little bit in history to what must have been one of the first conferences on faith-based organizations held in Oslo in, I think it was 2004, 2005, when Catherine Marshall was there, who had been very much involved with the World Bank under James Wolfenson as president. And she said that religion was now in the same position as gender was in the 1980s. That it was gradually going to be recognized as an important part of the humanitarian endeavor. And until then, there'd been extremely little research on any faith-based organizations, curiously enough, and practically nothing on Islamic organizations. But it was one of the key insights of Catherine Marshall and James Wolfenson that in religious networks all over the world, you had a kind of ready-made civil society that was already there, and quite different from the imposition of the kind of civil society from international NGOs, and therefore very important for humanitarianism. Since then, there's been a lot on churches, and it's difficult to come up with it's being written about it. But I think one has to set against the value of these worldwide religious networks. One has to set against this advantage for faith-based organizations, the fact that there are also the breaks on progress of fatalism and superstition, which has to be taken account of. I know from personal experience of Indonesia how this is a country absolutely full of humanitarian organizations of every kind, going back a very long way. In the case of the Muhammadiyah, for over 100 years, and the same is true of, I'm sure, of Pakistan, and the ED Foundation is perhaps the best known one in the West. But the whole tradition of Islamic humanitarianism and the importance of zakat and sadaqah goes back a very long way, but has been largely neglected in the West. And in the world context, I'm now talking about mainly the United States, there's been the terrible overreaction, in my opinion, against Islamic charities because of allegations of being involved with terrorism. And it's extremely refreshing to attend this online meeting where there's no question of that kind of slur or against Islamic charities, but it's just taken as something absolutely necessary and part of everyday life and the response to disasters. Something which should help with the development of Islamic charities is the emphasis on localization at the World Humanitarian Summit a few years ago. How much has actually been achieved in that direction, I don't know, but certainly there was an intention expressed in that summit to break down the monopoly, or rather I should say the oligopoly of large Western aid organizations. And as I've said, there are Islamic charities growing all over the world and a lot of research being done on them. Now within almost every faith-based organization, including Islamic ones, you have a tension between the religious commitment of the people running them and funding them, and the perceived need for professionalism. And I think you'll find this perhaps in all the organizations we've been hearing about today, that there is tension probably within each organization of pulling in slightly different directions. A key document on Islamic humanitarianism is the study by Maxwell and Majid on the Somali, the famine in Somalia in 2011 and 2012, and they draw attention to their experience of the commitment of the Islamic or the Muslim field workers representing Islamic organizations, that they weren't just doing a job for an aid organization, but they had this real feeling of commitment to the people they were trying to help. And I think I felt that with the presentation by Ms. Inda on the Hafa Foundation, that the emphasis on the human dignity of the people that they are helping. And this is my experience myself of Islamic charities in the Palestinian territories, where there's a feeling of that the disadvantaged people have a real right to the charity that people are giving. But a refreshing point is that there is no, in my view, there's no incompatibility between faith-based organizations, including Islamic ones, and the principles of secular humanitarianism. There's no reason, in principle, why they shouldn't work together. And this brings up the question of cultural proximity. Now, Arne, I think, was perhaps the first researcher who brought up the question of the comparative advantage of Islamic charities working in majority Muslim countries. And there's been a small research literature on this ever since then. I think it's an important point that this should not be taken for granted. It can't be assumed that a Christian organization or a Muslim organization is inevitably going to do better than a secular organization. But there's certainly evidence that in certain circumstances, they can do extremely well. Certainly in the Christian parts of Africa and in Latin America, the Christian churches work extremely effectively with local priests and churches. And the same is happening, has been happening, I'm sure, to a great extent, but is not so well recognized in the Muslim majority world. Obviously, these organizations we've heard about today have been through a crisis, an internal crisis, apart from the wider crisis of the pandemic, in having a crisis in funding, because their traditional donors have not been as able or not so concerned with helping them as normally the case, and have new technologies, and as we heard in Pakistan, of finding new kinds of donors like these commercial companies that want to do something to help. It was very much the message of Shahid, that it's the adaptable and alert organizations that are going to survive. And I think this applies to all institutions during this pandemic. The ones that have really done well by to new technologies, potential of online conferences and so forth, they're going to benefit afterwards, will be remembered afterwards for having done so well, and will benefit from the experience. Well, lastly, you all know more about the response to the pandemic in developing countries that I do, but it's commonly agreed that the pandemic has exacerbated world inequalities, and particularly with the vaccine nationalism that unfortunately we see in the West. But of course, there are so many problems that are linked to this, that the humanitarian world the humanitarian workers are having to face climate change and geopolitical conflict and so-called natural disasters such as earthquakes, which are going to hit, probably going to hit large cities, particularly in Asia, very hard over the next few decades. So it's heartening that there is progress in recognizing the achievement and the adaptability and the potential of Islamic humanitarianism, which we've seen in this excellent exchange today, which I think is going to play an increasing part in alleviating all these global challenges. Thank you.
Thank you very much, Jonathan, and also for your kind word on more on the field of research in here. I think some of these things are linked up as well, because some of what you have demonstrated here, well, we are in an international pandemic. This is not a regular emergency situation hitting one country or one region. It's really hitting the entire world, and it's straining every country's capacity, and it's requiring civil society and religious organizations in all over the world to be involved and to confront it and to collaborate on it. And I think part of the challenge now is that it's unequal how vaccines are distributed. It's unequal how assistance is distributed. And it's therefore so encouraging to see how institutions as yourself have been able to mobilize locally for the support, how you engage in discussions with your communities and with your politicians and step up and assist them in actually meeting these challenges in your communities. And I think it's what's been demonstrated here is extremely encouraging to see how you have managed to do that. And I think going back a bit to you, Jonathan, as well, this unique trust that you hold in the communities seems to have been then a mutual or a major incident or a major component, sorry, to actually to have to gain the trust of the people to follow the advice that you provide when they are in doubt about if there is really an epidemic, if they can trust your politicians, if they can trust your government. You seem to have played such a crucial role in engaging with people to have their faith in what you say and their faith in their own faith, that this is something they can be able to address. So I'd just like to run around this and also saying how impressed I am being agile, being able to make use of digital communication and being able to step into those kind of platforms. It's the future, but some of you have also alluded to, you're not necessarily reaching everyone here. The poorest, those living most remotely, might not be that easy to access. So there are still some challenges here, but if I can just open up, we have still 15 minutes for the time of this panel. Are there someone who would like to contribute there, share more information, ask questions to our panelists or to our discussant? Please do so either by posing a question or by raising your hand, please.
Perlindungan Siregar.
Oh, please.
Yeah. Thank you, Mr. Amos. I am from Indonesia, from Department of History and Civilization, ada Faculty, UIN Syarif Jakarta. I have short question, especially to Mr. Said Iqbal from Pakistan. Yeah, before I appreciate your presentation and a good presentation. My question is about your slide that you explained about point, challenge, changing practice and priorities and challenge. But in your slide, you don't explain there is a challenge about my opinion. What is the challenge that in my country, especially in my village in Ciputat, there is a religious teacher, we say Ustad, in my village, that he doesn't believe COVID-19. Yeah, and he said that COVID-19 is a conspiration from China. when I asked him vaccination, he said that this vaccine very dangerous because in this vaccine there is a dangerous chemical. He said like that. So he doesn't want a vaccine, and he has many students and many jamaah. Yeah, I think, yeah, he tell to his jamaah that it is conspiration. Now, about 3 weeks ago, the announcement in my village in Rempoa from the mosque about 3 times a day, Inna lillahi wa inna ilaihi raji'un, about 3 weeks ago. Yeah, they, I think, is isolation in the house, and they do not want to go to the hospital because they are very confident that it is not COVID-19. I think it is a challenge, yeah. And how about in your country about this challenge, and why don't you tell it in your slides? Thank you very much.
Thank you very much. I think this question was then directed towards Pakistan, and but I think it's a
Yeah,
general
okay.
question. But maybe those of you from Pakistan could come back and say how you specifically was able to address this in Pakistan. And there is a question posed as well to the Forum Zakat that you, Arif, might take a look at while we are hearing from our friends from Pakistan. I don't know if Shahid or Syed would like to go first.
He was right in saying all these things in East and West both. Like, it's not only about Pakistan or Indonesia, or even there was many people in India and many influencers, like they have millions of followings on YouTube and all these things. I think in Pakistan, there were some people, and there are some people, even in our polio vaccination campaign, there were some, Kaja used to be in Pakistan, and she have experienced that. I think she have worked on that as well, on some social issues. For the polio vaccination, even there were like a group who are saying that this will, you can say that our men and women and all these sort of things. So I think that in every community such people exist. The thing is that majority of the people, where they are going. For example, what we have said, you know that we have a very large following in the faith-based organizations, and we have people that people used to listen to them. When the vaccination was announced by the government, the first thing that we have done is, I am the only non-doctor in that Corona task force. So the rest of all are the doctors. Our chairman was a professor, and he is a principal of a medical college, and the rest was also doctors. I was only a non-doctor. The first thing that we decided, that on the second day when it was announced, we as a team went to the vaccination center, and we vaccinated and participated in the trial, and we announced that in a press conference, that we as an organization are participating in it. Then our president of the organization in next week got the shot, and it's like, it's a clear message that vaccination is all right, it has nothing to do. And we have worked on that. Like, we have asked our doctors, we have professors, we have people in the virology sector, and after their advice in 3 or 4 days, they say that it's okay. It was the initial days. So I think it needs not only in Muslim communities, but even in Christian communities. I have seen that mobs in London and in US cities, and they would say that it's a scam and it's a fraud, and there were placards. So the need is that we have to be consistent in disseminating this information and all these advocacy and these things. So it will die down, although it cannot be, you cannot eliminate these things totally, but the majority will come on the vaccination, and they will come on the mask and all these things. Thank you very much if I was able to explain. So
Thank you.
Thank you very much, Shahidik. Syed, would you like to add something from your experience from Pakistan, or did Shahidik cover it all?
Yes, from my side, I want to add something. The reason that I already mentioned in my presentation that Dr. Talib Qadri is having millions of followers, and he is very much clear about this, and all of his followers, all of members from Minhaj al-Quran and from Minhaj Foundation are very much clear about this, that all these needs should be fulfilled. First, the social distance and SOPs of this pandemic, which may protect you from having that infection. And the next thing is that the vaccination. And all of us are directly and indirectly are influenced by our leaders, as well as we are influencing all of our workers, all of our members in this way, that this is not a conspiracy. This is actually, this virus exists, this disease exists. And if you want to protect you, yourself, your family, and your society from this pandemic, so you should follow all those SOPs, and then you should be vaccinated. So Alhamdulillah, all of our family, even my wife, myself, all are vaccinated. All of our members, all of our volunteers, whom are getting this opportunity, because here in Pakistan, that was in stages. First, they launched this vaccination system for above 60 years of age, then from 50 to 60, then from 40 to 50. So all those people who are having this opportunity to have this vaccination, so they are vaccinated, Alhamdulillah. So having such type of negative information by someone we don't deny this, that it doesn't exist in our society. And as Shahid Saab mentioned, that it exists in every society. Such type of negative views, such type of negative promotion, propagating those negative things in society. But we are here, we should take this responsibility, and we should communicate our messages to masses and to all of our followers in this way, that this is not a conspiracy. This is in real situation. This disease exists, this virus exists, and it may damage our health in this way. So automatically, if they are promoting negatively, that is very minimum portion of society and very minimum number of people. And the people who are well aware and who are actually educated, they are aware of this, that through following SOPs, keeping social distance, wearing masks, wearing gloves, and using sanitizer and washing hands may protect us, and through vaccination, we may protect ourselves as well as our families and our society in whole. So we are doing right from very beginning. And as I mentioned again and again, that our leader, Sheikhul Islam Dr. Talib Qadri, is emphasizing this point. And I want to share one of my experience, that in the beginning, just because of workload, in a few situations, I was in some pictures, he saw me that I'm not keeping that much social distance which is required. And I was called by him, and I was instructed, as well as I was guided and by all of my seniors, that keeping in view your social activities, that is important, but your health and your health safety is more important. So whatever you will be doing, you and your whole team must keep social distance, and these activities must be done in those SOPs. After that, you will be the real success. That would be the real success. Otherwise, if you are losing yourself, you are losing your life, and you are doing all those. So it's mean that you are not following that. You are not considering that. So we all are well aware of it, and we are not only well aware, we are making this campaign as well, taking this as a campaign, and already a number of times we did this campaign, and through even printed material, we launched a number of times, we launched these campaigns that people should be aware of all the negativity of this pandemic.
Thank you very much, Syed, for this important question from Indonesia. We have, I think we need to round off, but we have two questions coming from Gina to the Forum Sakat. The first one is that you pointed to the importance of providing information. How did you work to gather reliable data? I think that's a good question for any researcher. And question number two, where you also asked to give a theological interpretation for your practices. Arif, do you have some answers there?
Okay. Thank you, Dr. Strand, for the time, and Gina, thank you very much again for the question. So, how do we collect? If I'm not mistaken, your question is about how do we collect? How is our organization work on collecting and gathering reliable data? Most of the times we are very much reliable on the, of course, from the reputable media report. Most of our data and information is not based on social media, since as my presentation has stated out that many information that's circulated in social media is mostly are hoax and false information. So our first source is, of course, a reputable media report. But then again, most of our data is coming actually from the volunteers and the officers of the programs from our members of Zakat Management Organization in Indonesia. So basically, like from Ms. Indah presentation, lots of our organization is working in the rural areas, working in very remote areas, working in also again in the urban areas. So many of the officers are reporting about, like, for example, this area, this district is in need of health or medical support. This area needs of food item support. That kind of data, that kind of information circulated and then was distributed to us in association, and then we manage the data, and then we try to connect the organization that could provide help and assistance to the state, to that area that is in need of assistance. And then, yeah, basically most of it is coming from a citizen report. Gina, how can we rely on the data? But again, we do not take social media as our prime source of information. And then about theological interpretation, well, since Forum Zakat, my organization is working mainly about managing our members, so we do not directly involve and directly connected with the Islamic scholars or ulama, but most of our members, all of our members, have their own Sharia board officers that provide fatwa or Sharia opinions in a daily basis from A to Z about how the program can be conducted accordingly to the Sharia law, how can be the fundraising or the crowdfunding can be in line with the Sharia law. All of our members have their own Sharia board, but in the national sector, we can also rely on the Majelis Ulama Indonesia or the Indonesian Ulama Assembly it's not a government-based organization, but it's more like consists of many ulamas coming from a different organization like Nahdlatul Ulama, Muhammadiyah, Hidayatullah, and so on, that gathers in one assembly organization, and periodically they distribute about fatwa and Sharia opinion on several matters. Hopefully that answer your question, Gina. I'm not sure. Hopefully, but I think from your face, it's a good answer. Oh, thank you.
It was a very good answer, Arif. Thank you. Thank you very much.
Arne,
Yeah.
can I just ask, because there, I mean, the legitimacy of organization is important all over, but the constituencies are different, social context is different. So I just wonder, is it like to have these Sharia boards? It's common in these Islamic philanthropic organizations in Indonesia. Do you have something similar in Pakistan at all, or is this a relevant question in the Pakistani context? I would be very curious to a quick answer from you, both Shahid Iqbal
and to you, Kaya.
So this is going,
Yes.
going to our
Yes, we have.
Pakistani panelists. Okay.
Yes, it's a short answer. We have a Sharia board and we have a Sharia advisor, and most of the organizations that are working in Pakistan have, and even now businesses have started hiring Sharia advisors for their zakat calculation and their charity calculation. It's a new trend that has emerged in the last 5 to 6 years. Most of the large businesses have their own mufti, or you can say cleric, or the degree holder as well.
Thank you very much for the clarification. But now I'm afraid we have exhausted our time. I think this, to me, has been extremely rewarding to be able to be asked to chair this. I've learned so much, and I see so many similarities between Pakistan and Indonesia here as well. And I see a well of things that I would love to discuss further, preferably meeting up with you over a cup of tea and being able to sit together and discuss it. But I think also this is the beauty of the digital media, because we could now have with us a lot of colleagues and friends here that have joined into the discussion. So there are some advantages of this digital revolution here as well. So I just want to round off here. Thanks all for your great presentation. Thank you, Dr. Benthall, for an extremely valuable comment to this. And I hope we will all continue in this discussion, and we all continue in the struggle against COVID-19 in our all capacity and best ways. Finally, I think the organizing committee has asked us if we can to fill in an attendance form at the link that was distributed quite early here. I would just advise you to do it, and then I wish all the best of health for yourself and for your families, and hope we all soon can meet again. Thank you.
Thank you.
Thank you very much, everyone.
Thank you, everyone. Thank you.
Thank
Nice
you.
invite.
Thank
Stay
you very
healthy,
much.
stay
Thank you
safe.
very
Thank you.
much.
Bye. Thank you, Mr.
Thanks a lot.